Hi, my name is Bon Jovi Valarao. I'm a respiratory therapist with a neonatal pediatric specialty. I get to be your classmate for this course. To introduce myself, I enjoy reading books. Just recently, I finished the 7 book series of Harry Potter. I reread it. This is the second time. Honestly, it's always amazing. You can never go wrong. Um, it's just the audiobook by Jim Dale, mind blowing with character voices, great. I might even just watch the movies again, who knows? I have the time. And then, as far as other books, I do enjoy some nonfiction books. I think one of them that has left a huge impact in my life has been I Will Teach You How to Be Rich. It's a really great book about money management. A lot of things that I wish I learned a lot younger, or things I've learned from my parents but never really did. So if you get a chance to read it, give it a shot. How I like to spend my time recently has been going to the gym, doing a little bit of light bodybuilding. I'm very new to the sport. I know I recently turned 30, and honestly, my body's not gonna get any younger. I just need to start maintaining what I currently have, make it more efficient. So I've been going to the gym a lot more. I do want to share that I'm very proud of my recent deadlift. I can do 135 kilograms, which is about close to 290 pounds. Very clean. So it's been very exciting, very fun journey. How long have I worked in healthcare? Well, I've been working as a respiratory therapist for about 8 years now. The first 5 years was spent in children's LA. I was initially there as a student, fell in love with the place, fell in love with the way they practice, and I worked there. Luckily, one and only place I applied to, I got the job, I got the position as a new grad. And 5 years later, it's brought me to, it has given me so many foundational skills, and also seeing a lot of sick patients, seeing how management is done. It was a mind-blowing experience. It was great. I will never regret that. And as a new grad, I think it's very valuable information, and just the clinical aspect of it was just an experience. After those 5 years, I did take a 6 month sabbatical into Latin America just to give myself a little bit of break. This was a little bit after the pandemic as well. So those 6 months was spent hopping around Peru, Guatemala, Costa Rica, even Colombia. And I got to learn some Spanish. I got to do a little bit of dancing of salsa, bachata. It was a wonderful experience. I do want to say it opened my eyes to newer cultures and how much America has a lot to be grateful for, but also how much America has a lot to work on, culture-wise specifically, the way things run or how we just live. Yeah, so I do have a couple of friends now. I've met a couple of expats who are living out in Colombia, for example, and they love it there. They're living out there for less than $1,500 a month, and they're living quite comfortably. If only we could find something like that in America, that'd be great. Let's see. After that sabbatical, I returned as a respiratory therapist for a traveling company, and I actually returned to one specific hospital just because I really enjoyed my time there, working with a team, and it's actually one of the parts of healthcare that excites me the most at this point. So at this time, I actually really enjoy attending high-risk deliveries, and this hospital has taught me so much, and I'm very grateful that they keep asking me to come back, and I plan to apply soon as a full-time staff. From coming from my children's hospital experience, we didn't have a labor and delivery unit because we didn't have adult care, so we were strictly kids. So a lot of these patients, these newborns, would come in already given a 1 dose of surfactant or already intubated and all these stuff. In the labor and delivery, in the delivery room, is completely different. The moment the baby comes out, we're doing the first hands-on care, the APGAR scores, the first minute of life, super critical to determine how much support this child needs. Working at the children's hospital, I've only ever given a 2nd dose of surf, never the 1st dose. At the delivery hospital, wow, surfactant is an amazing drug. I just want to say, the difference between the child is night and day after giving surf. I also enjoy the fact that working as a respiratory therapist there in the labor and delivery unit it has its challenges as well. It's exciting. You can have a lot of nights where it just feels very slow, nothing's going on, but 2 minutes later, you're getting a page that, hey, there's a 23-weeker coming in that nobody expected. 23 weeks, wow. science. So that's given me a lot of excitement to come back to work every single day. One of my biggest professional challenges at this time, I do want to say, it's always been, it has been, it's getting a lot better. Confidence. I never really felt confident at bedside. I get a little bit nervous, anxious, afraid of what to say. I also had these times where I felt that I'm just not enough. Like, why am I part of this conversation? Just tell me what to do and I'll get it done. I'm afraid to give my input. But that was before taking the entire like Boise course. After the course, or just after X amount of classes from this course, I've learned that I'm actually a very critical voice in the team. So it's opened my eyes, and I've actually started speaking up a lot more. I've been participating, putting in more input in patient care, and it's honestly, I feel more fulfilled in my role. And I'm working on getting better at it. Anyway, it's a pleasure to meet you all. I hope to do some discussion boards with you. So, bye.